Late Night Health continues. I'm Mark Alyn, and we're going to go to Santa Barbara, California, just down the street from where Late Night Health is. And we're going to be speaking with the author of Great Saves and Terrible Losses. We're also going to be speaking, and that's Dr. Anthony Goodman, and he's accompanied by his wife, Maribeth. Did I get that right?
You did.
Maribeth.
Very bad.
Maribeth.
Yeah.
And we welcome you to Late Night Health. Um, and we have to point out that Tony is suffering from, and I don't know if that's the right word, but we'll ask from early Alzheimer's. Am I correct?
You're correct. I don't feel as if I'm suffering, but I do have early, what's been called and diagnosed as early mild Alzheimer's disease.
Let's start with that, if
Yeah,
that's all right.
sure.
As June is just around the corner, and your book is coming out in the middle of the month. When you were given that diagnosis, were you surprised?
I wasn't completely surprised. I knew there had been some changes, and friends as well as Mary Beth had pointed out one time and another that what's going on? Where's Tony? He's not showing up. That was about as definite as they got, wouldn't you say?
Well, you know what's interesting, Mark, is the symptoms show early, and so many people have these early symptoms, or families will see them and they hide them because there's unfortunately a cultural shame about the disease, and so people unfortunately hide to their own detriment and to their family's detriment because it's the early diagnoses that allows for the benefit of the medications that are new now. There's some wonderful ones out now, but you really need an early diagnosis with many of them for them to work.
Right.
And so one of the messages Tony's been out front about is having an educated patient. And in order to become an educated patient, it's going to be important to get that diagnosis early.
When you go to a doctor these days and you say something like, "I think I have blank," or because I've done research on the internet. We had a doctor say to a family member, "I went to a real medical school, not Doctor Internet." Does d- you know? What do
That's
you think,
unkind.
Tony?
Yeah.
Yeah. Well,
Um,
I think you can tell Mark a little bit about our first meeting with a neurologist and how that went for you.
Well, the first neurologist I went to said, no, you don't have Alzheimer's. This is just normal aging. And neither of us felt that was true. He went back to the referring doctor and told him, he said, this is not normal aging. I need to send you to a better neurologist. And the next neurologist said, this isn't normal aging within 10 minutes. And he said, you've got Alzheimer's
You have dementia.
and dementia. Basically, that's where you got to find out what kind of dementia you have. And the diagnosis was then Alzheimer's. And he sent me to a better neurologist who right on it in 10 minutes said, we've got this Alzheimer's dementia, and here's what we're going to do. He did further testing, narrowed it down, and got right to the treatments.
and Maribeth, what about you? When you heard that diagnosis, did you go, uh-huh?
Well, our doctor said most partners see it in their partners, and I saw it. And I also, Tony and I've learned a lot is that we didn't know dementia was a symptom, not a diagnosis. I mean, dementia simply, it's like saying you have a fever. So what's causing it? And, 60 plus things can cause dementia, which means forgetting. And so there was that going on. And the doctor said, it could be caused by dozens of things that can cause dementia. And so he really did a thorough analysis. And when he diagnosed Tony with early mild disease, Tony immediately reached out to the family and friends and very courageously stood up and said, "This is happening. I want you to know." And that's made a world of difference for him and for the family.
Yeah, it was important to get everybody involved and not everybody wondering what's going on.
And you spent your adult life as a surgeon,
Right.
right?
Yes.
Uh, and I'm assuming that those are some of the great saves of the book.
Right. And also some terrible losses where you thought it was going to be okay and it wasn't. So we always had to accept that. We couldn't save everybody.
Do you feel do you mind me telling how old you are?
Oh, right. Today I'm 86.
Today you're 86. Okay. Do you feel any different than when you were 26?
Well, a little bit, not much. I feel wiser, but not as strong. I'm actually quite healthy. I don't have any overriding disease. I'm very grateful for that. You know, the medicines I take are minor, mostly supplements and vitamins. And I feel very, very happy that I haven't been invaded by other things people my age get, especially my
We
brain.
talk about supplementation a lot on late night health because we think
Yeah,
that, you know, the food isn't as good as it was maybe 100 years ago or even
yeah,
50 years ago,
yeah.
right? We we need supplementation. Do you miss seeing patients?
Oh, yes. I miss most of all being in the operating room. For me, the best part of my day was walking into the operating room. And I always made sure they didn't put my patient to sleep until I said hello and had them tell me what they had and had them tell me what I was going to do. So there was no ever any conflict in that. And I was going to say okay and wish them well, and then they could be put to sleep. And so I love that part, and I love being able to go out and talk to the family and tell them everything was going to be okay or exactly what was going to happen. That was a wonderful time for me.
What many doctors, many surgeons don't do that. They walk into they want the patient knocked out. They don't want to talk to him before, during, or even after. It's sad. I mean, you go into a an internist these days and you get 7 minutes if you're lucky.
Wow.
Yeah, I
And
understand that. And I understand that it happens. I don't understand why. To me, this is all part of one part of the treatment is to be part of the patient and their family. And it's not just the operation and the technical stuff you do. And the joy is getting to know the patient, what's wrong with them. And then as a surgeon, you know, it's very active. You're gonna usually cut something out in their whole life. If you can do it, it's gonna be restored. So there's a real joy in that, and I feel sorry for the patient and the surgeon who doesn't get that kind of joy.
Because as you've often said, those patients have waited a long
I
time.
know, yep. And they have, and you know, there was a study that said the average time that the doctor listens to the patient is about 17 seconds before they interrupt and move on. That patient may have been waiting months to see you. And my job, I felt, was to ask a question and then sit back and listen because they had a lot to say. And that was really, really important.
I want you still to be practicing.
Well, I enjoyed it. I loved going into surgery. That was the best part of my day. It was when I walked into that operating room and had my whole team there and the
And the
patient and
nurses.
then all the nurses. They were so critical to what we did. They were more important than we were. They saw the patient, talked to them, took care of them. I was just in there for an hour operating, and the
And
nurses were the
it's
real
interesting
key.
you say that because, you know, with everything that's going on today with insurance and Medicare,
Mhm.
um, medicine has changed,
It has.
and doctors don't get to make the decisions anymore. A pencil pusher, as we used to call them, uh, they're the ones who are saying, well, you can use this drug or not this drug. And Maribeth is shaking her head.
We agree. I mean,
We agree with
that's why
you.
you advocate for educated patients
I
who
want
are
an
in the
educated
system.
patient.
Yeah.
I've written about it, and to me, the unsung heroes of this are the nurses. They're in there all the time, taking care of the patients, and the patients recognize that.
Yeah,
So,
absolutely. Um, we only have a minute left in this segment. Um, What was one of your best saves, one of the great saves,
Hmm.
Which one? Do you
I think I
Tony?
was 9 months pregnant, 8.5 months pregnant.
Yeah, I had in two, they were almost identical and a week apart. I had patients who were in the last month of pregnancy and, enormously full of uterus and baby, and they had inflamed gallbladders that had to come out
Oh
because
my.
the rupture or infection could spread to the uterus and everything could go wrong. And it was a very difficult decision trying to decide which was worse, the possibility of this going wrong or leaving that gallbladder in and making it even worse. And then an operation was really difficult there. Everything was hidden from view. You could, I'm trying to get the obstetrician to pull the uterus away while I can get to the gallbladder, and he doesn't want to get things going. And we struggled together, and in both cases, everything went well. We got the gallbladder out, the patient was fine, and delivered a healthy baby soon after. And one of those babies, a few years later, ran up to me in the street and lifted up her skirt and showed me her incision. It was wonderful.
I love it. By the way, do humans need their gallbladder?
When they're just, oh no, no, they don't. They can get perfectly well without them. They don't really, other than getting rid of the pain and the infection, they don't need it.
Wow,
The body
great.
can do without it.
Our guests are amazing people. The author of Great Saves and Terrible Losses, The Journeys of a Surgeon, Dr. Anthony Goodman. The book will be out in the middle of June, and I would assume available at all good places like Amazon and other.
All independent bookstores, and also from Tony's website, anthonyagoodman-author.com. You can and learn more about Tony.
Oh, that would be great. All right. We're going to take time out, and when we come back, we will continue. Don't go away as Late Night Health continues. Late Night Health continues. I'm Mark Alyn, and we are talking about a new book. It's called Great Saves and Terrible Losses, The Journey of a Surgeon by Dr. Anthony Goodman. We are talking about the fact that after years and years of being a great surgeon, Tony was diagnosed with Alzheimer's, and we've been talking about his great saves in the book. What are some of the terrible losses that you also encountered, Tony?
Rather than specifically, I can say there are many times when you just cannot do what you want to do for the patient. That what the disease is or the accident is or anything else has put the patient in a position where you can't fix it. And I think those are the worst. We've got so much at our disposal these days to help almost everything. And at a certain point you're going to try, and that it's very unlikely you're going to help and not make it worse. And that's the important part. We have a Latin saying that ends up being above all, do no harm, is the way it's translated. And we have to remember that all the time, that if you can't do anything else, don't make it worse. And
We're recording this program on Zoom, and right now there's a lot of telemedicine. What's your take on telemedicine, Tony?
I don't
Well,
think
they're
that
not in practice now.
I'm not in practice, so I
Right.
don't know what the most current things are, and I don't really watch telemedicine, so,
It's accessing a doctor,
oh,
getting doctor,
okay.
yeah, talking to a doctor on the computer.
I think I don't know. I have never done it. I've always been in person with my patients. And so I can't really be a judge or a critic of it or someone who wants to say it's good. I don't know the answer.
So
Do
I'll
you?
say, Mark, Tony's very old school. He retired his practice in the early 1990s before a lot of the corporatization of healthcare and what's happened, and certainly before telemedicine. For the last 30 years, he's been teaching. in the medical school. So in terms of the contemporary issues
Right.
of whether it's telemedicine or what's going on with AI,
Yeah.
it's kind of not in your
I
wheelhouse
have
right
no
now.
personal experience with it. I really like being there with the patient in the room, being able to talk and listen and then touch the patient. And so
You
that's where my life was.
touching the patient. Isn't
Yeah.
there something about that? There's a magic when a doctor, even if it's just a hand on the shoulder as you
Yes.
leave, it helps.
And you have to remember to ask the patient and say, I'm going to need to examine you. Here's what I'm going to do. Is that all right? Because that's very, very personal. And you may hurt them too. You got to tell them that this might be uncomfortable. In other words, it's going to hurt. And be as you would with any stranger, not touching a stranger, which they generally are,
Yeah.
and the first time around. And remember those things that are about being polite with the patient, besides just being the doctor who's in charge.
And
It's
this
very
is what you
important.
taught your students
I did. I
about
tried to
teaching
teach.
taking care of the whole patient.
Yeah, it was wonderful to talk to the young students. They were so excited, so ready to go. And in a place like Montana, many of them had never been in a big city hospital. And they were so happy and often the first of their family to either be in the university and certainly the only medical school in Montana. And it was wonderful to teach them. They were raring to go and learn everything.
My experience with Montana is I'm trying to think of the TV show that just aired.
Yellowstone.
Yeah,
Yellowstone.
Yellowstone.
Yeah,
Oh,
yeah.
Yellowstone. That was it. And because Montana raises a lot of beef, is beef still good for you to eat once in a while?
We have a different opinion.
we have different opinion.
Yeah,
I think everything in moderation, right?
right, right.
And yes, Montana raises a lot of beef and people eat a lot of beef in Montana.
They do. They do indeed. Um, I had another thought before I sidetracked myself. Um, the the um, the state of health of of friends and family, um, the state of health of the country. Um, are we good, bad? Are we healthy? Are we not healthy?
I don't think you're in a position to say that.
Yeah, I don't know. I can only tell you about my own family, and they do come to me often with my recommendations, and sometimes they follow it, and sometimes they don't, just like anyone else does.
Right.
I think overall
Compliance.
we've got a lot to offer. And it's great when people ask. And then I don't know what the percentage is of people who follow these things. Sometimes it changes their lives a lot for the better, and it may take a lot of effort to do that. So we may be asking a lot of them, but we have a lot to offer now that we didn't have years ago. And the question is to get people to try to get onto these new programs.
And you're right, Mark, the state of of healthcare and how it's delivered now, especially with the corporatization of it, has changed. And that's why, you've been speaking pretty vocally about being an educated patient and being your own advocate,
Yeah.
and being ahead of the curve and really having to be part of the team.
Yeah.
Where people used to just say, oh, whatever the doctor thinks.
Right.
Right.
Right. It's important that the patient has got to be educated first, and then they can be their own advocate. So they have to listen, they have to do some reading, get educated, and ask the hard questions. Don't just take everything you get as being what's best for you. If something sounds funny to you, you just got to ask or go get another opinion.
And expect answers.
And if anybody is upset by your asking for a second opinion, then you don't want that person to be your doctor.
Yeah, absolutely. I love that. What about having an advocate with you?
Oh, excellent.
Maribeth is your advocate at this point.
Absolutely. It's always better to have, I always ask the patients to bring someone along for the family. Because especially when it's serious matter, and I was a cancer surgeon, they don't hear half of what you've said, or they've heard it and it's gone. The emotion rushes in. And when they get home, they may hear a whole different story that their advocate heard and may have written down, and sometimes calls you back to find out. So I just don't want patients to come all by themselves for this serious issue. I ask them to bring someone along, close friend or family.
Got it. What motivated you to write the book?
Um,
Well, you started writing this book. It's been over 30 years in progress, which is so
Oh, right.
interesting. Yeah, yeah.
I started writing it a long time ago. She said 30 years ago when I was just looking to see how I got into all of this, what started it. And it started when I was in sixth grade. So I really had a lot to write and try to trim down and make it interesting. But I knew when I was in sixth grade that I wanted to be a doctor and specifically a surgeon. And I never varied from that.
Wow. The- we've discussed um, the fact that you taught in medical school. Do you think that the students that you taught like the fact that you're an old-fashioned kind of a country doctor?
Well, I never try to let them think that, but the students I taught were wonderful. They were so happy to be in medical school. We had a very nice ratio of the teachers to the students, and some of them eventually became my doctors. One of them operated on me,
Huh.
and it was a wonderful association. Small town, we all knew each other, and I was very happy to be associated with them. They were very selective in who we took, and they were wonderful students. So it was good for me, and it was good for them.
And because your
And
own teachers were so important to you.
Oh yeah, all my own teachers, I tried to remember in the book and talk about them because they were absolutely pivotal, including one who knew I wanted to go into practice in Boston, where my wife was from, my then wife, and got me set up to switch from where I was to a program at Harvard so that I would be there and know the surgeons there and have a reputation so I could go into practice.
Maribeth, you're not from Montana then.
No, as I said earlier, Tony's practice was actually in South Florida. That's where he
Ah,
was
I
practicing.
wasn't sure Montana was a state when
Well,
I got there,
so
but
got it.
we were,
I
we
remember that. Yeah.
were,
Listen,
yeah.
it's been a joy. What would you advise, Tony, to patients when they're given a devastating diagnosis? What advice would you give? And Maribeth, I'd love to have yours as well.
Are you speaking about Alzheimer's in particular,
It
or
could be,
or any
yes,
diagnosis?
I
Okay.
yes.
think the first step is to get the whole family involved and probably in person. Have someone important to you and your family come with you, and maybe more than one person to the next visit, so that you have somebody hearing the same words but maybe a different interpretation. And then also get together and decide on a second opinion and get someone else to verify what your doctor has said to make everybody comfortable with what may be an uncomfortable diagnosis for everybody.
You know, Mark, back in the day, cancer was whispered. We didn't talk about it
Right.
until maybe 70s, 80s. I don't remember. But Tony wrote one of the first books about breast cancer for women, wanting an educated patient. It's like, this is important. Early diagnosis is critical, as we now know. It's with many diseases. And the same is true with Alzheimer's. We have to, and this is a very important message, destigmatize all forms of dementias. People are reluctant to get care, and then their families don't get the care. And so, if any strong message, that would be it.
That
Don't be
would be
afraid.
it.
Yeah,
Yeah,
be
And
speak
and
up.
let's
There's no shame, right?
no,
Yeah.
shame is the problem. And we've got to get rid of that. There is no shame that you have a disease. It
we
wasn't your fault and you need to get help.
And the
you're
early
a
medication.
very brave and upstanding person, Tony, to be so open.
Yeah,
Thank
yeah,
you.
I agree.
And we're here to
All
help. We're
right.
supposed to be here to help.
I agree.
Yeah.
That's our job.
That's right.
And how long have you guys been married together?
44 years we've been together.
We think it'll last.
Yeah, I think so. I think so. Listen, thank you very much. I really appreciate it, and hope you enjoyed our time together. Hold on for just a second. Thank you very much for tuning in. Have a great week. Have a good week, and most importantly, have a healthy week. We'll see you next time. Bye bye for now.